This is normalized by population, average deaths, 7-day average. Look at the difference there. The space between their line, which is orange, and ours, which is blue, show all the extra deaths that they experienced that we didn't, even if you adjusted us by population. And remember, they were reporting 10, 11,000 cases a day, sometimes hundreds of deaths per day. And this was deadly. It was awful. What they went through was so difficult. And it's why we took the steps to stop our escalation during this period. And look at the difference in those two graphs about taking aggressive, real action and not. It's not just the difference between life and death. It's the difference between a whole lot more deaths and a whole lot fewer Kentuckians that we lose. And listen, the summer was dangerous, what we saw in Texas and Arizona, but it pales in comparison to what we see now. So what we're going to do, and hold on just a second, is we're going to overlay South Dakota, which has refused to take any steps currently in fighting this virus. And when we overlay it, it's going to show where they are now compared to us. But I want you to look, when we show this, at what happens to the Florida versus Kentucky, because this is prominent when you look at this difference in death. But how does it compare, even something this significant, to how dangerous it is right now? Go ahead, Jim. Look at that. Not acting now is catastrophic. Not having the ability to act right now is catastrophic. The amount of death normalized by population currently happening in South Dakota makes what happened in the summer in Florida and Texas and Arizona look like a blip. The sacrifice that we took over the summer to protect our people could be entirely wiped out by not having authority and ability to fight this virus in January and February and March as we're getting this vaccine out. Look, this is an example, when you look at South Dakota, of a governor not taking steps at all, and what it means in terms of loss of life. And remember, that space and the green line all the way down to the blue line would be thousands of Kentucky deaths that right now, as long as we can stay the course, as long as we don't surrender at the end and near the end of this virus, those are people that we won't lose. But if we see types of legislation, some of which has been pre-filed, we could very easily be that green line. And those are your relatives, those are your friends, those are your neighbors that we would lose. We cannot let that happen. Let's stay the course. Let's continue to fight this virus. Let's continue to protect one another. Let's get everybody who wants to vaccinated, and let's beat this thing. All right. Today's report, while again higher than we ever want them to be, is lower than last week's Tuesday and lower, significantly lower than the Tuesday before when we had over 4,000 cases. Today, we're reporting 2,946 new cases of COVID-19. Our positivity rate, 8.53%. The last 3 days, it's really been consistent. To give you a comparison, last Tuesday, we had 3,114 cases we reported. The Tuesday before, 4,151. So again, better than the last couple weeks. We have an uptick, though, in our hospitalization in our ICU, 1,788 Kentuckians in our hospitals for COVID-19, 438 in the ICU, 246 on ventilators. New cases by county: Jefferson, 418, Fayette, 162, Warren, 123, Davis County, 122 cases, Madison, 120, Pulaski, 84, McCreary, 73, Hardin, 68, Laurel, 66. Laurel's been hit pretty hard. Boone, 63, Whitley, 60, Kenton, 59, Oldham and Clinton, 51. The others can be found on kycovid19.ky.gov. Sadly, we're reporting 15 new deaths today, due at least in part to COVID-19. And remember that even though our cases are looking better, we believe in the very least we have plateaued. Deaths follow the cases from about 2 weeks ago. So that escalation that we had results in people that we lose. So today we're announcing the deaths of a 68-year-old man from Boyd County, a 62-year-old woman from Caldwell County, a 77-year-old man and an 80-year-old man, both from Davis County, an 88-year-old woman from Graves, a 77-year-old man from Hardin, a 61-year-old man, a 64-year-old man, a 78-year-old man, and an 83-year-old man, and a 92-year-old man, all from Jefferson County, a 90-year-old man from McCracken, and then 3 from Ohio County, all women, ages 87, 91, and 91. And these aren't just ages and genders and counties. They're real people that we're losing. They're even heroes. So on December 11th, Kentucky lost a hero in the passing of Chief Robert Lee Orkes of Shepherdsville after a battle with cancer and COVID-19. The chief was only 55 years old. The chief's family shared that he was destined to be a hero. After losing his own parents, William and Patricia, early in his life, Rob learned to cherish family, love deeply, and live life to its fullest. He was lucky enough to have found his lifelong love, Billy Joe, when he was a teenager. They shared a love like no other and were together for more than 37 years. He adored Billy Joe, his son Patrick, his daughter Trish, their spouses, and his granddaughters, Presley and Riley. Nothing in his life came before family. But if you know Rob, you knew his heart was big enough to love more than just one family. His passion for firefighting started in 1984 and never left him. He loved the brotherhood of the firefighters and felt driven to be a leader. He had the opportunity to work for several fire departments in various roles, but he cherished his time as the chief of the Zonetown Fire District. He respected his position, and he always had the goal to make his community a safer, more enjoyable place to live. In addition to his duties as chief, he prioritized helping citizens of Kentuckiana through Crusade for Children, where his firefighters learned to work together with the community for the good of others. The chief was also known as the local Santa on the yearly fire truck visits. He touched more lives than I think even he could have ever anticipated. His crew, his colleagues, and his firefighters respected him for who he was and loved him for who they strived to be. Rob was a leader in all aspects in life and always wore his heart on his sleeve. You can tell from that photo right there. He knew exactly how he felt about you. If you spent 1 minute with him, he left a little happier and a little more loved. His silly sense of humor is irreplaceable. There wasn't much he wouldn't do to make you smile. For his many friends and family, his loss is immeasurable. But if you were blessed enough to know Rob, you were honored to love a hero. To Rob's family, to those little granddaughters, we are so sorry for your loss. And in his honor, we're going to protect other people just like he did during his life. We're going to wear masks. We're going to do right by our neighbor. We're going to live up to the example that he set for all of us. In addition to Rob, we have some other loss to talk about today. 2 more veterans at Thompson Hood Veteran Center in Wilmore have died of COVID-related complications. Brings the total number of veterans that we have lost in that center to 33. There are no active cases of COVID-19 in veterans in any of the 4 veteran centers now in Hazard, Wilmore, Radcliffe, or Hanson. There are 0 new COVID positive cases in veterans in any of the centers. And Thompson Hood has now gone 30 days without a new COVID positive veteran. But remember, this is what community spread does. This is us as a community letting these individuals down. We got to face that. We kept the virus out until October. Nobody infected. protecting those that had fought for us, our country's veterans. And just since October, we've lost 33 of them. It's not acceptable. We've got to do better, and we owe them more. So long-term care facilities, of which they would be included, 200 new residents testing positive, 109 staff, 20 additional deaths attributable in the system, including 1 staff member. This is why we have prioritized this group and why our goal is to get every one of the residents and every one of the staff members vaccinated in the next couple months. All right, with that, we'll turn it over to Dr. Stack, who's going to go through a little of the federal data used by Dr. Birx today.
Thank you, Governor, and good afternoon, everyone. James, if you could put up my slide deck, please. I'm going to share slides that we took directly from Dr. Birx's presentation today. Dr. Birx spoke with the governor and I and shared this information, and she also spoke with other leaders from Kentucky and shared this. So the observations she made were that the current surge we're seeing across the country is rising much more quickly than it did in the earlier surges. It's much more broad across the country. I think I used the metaphor before. It's like you took your grass seed drop spreader and seeded the entire front lawn, and now all the little grass is coming up all over the country. Well, we seeded the entire country with COVID, and now it's blossoming all over the country at the same time. The surge is also much longer than the early ones, and in just a second, I'll show you that visually. She also identified for us things which we know already and agree with her about, that new cases result in new deaths, and that we're seeing much higher numbers of deaths across the country, particularly as the cooler weather drives people indoors, that any gathering indoors without masks is a risk of spreading disease. It doesn't make a difference if it's out at a place of business in public or whether it's in your own home. They are all risk of spreading disease, and they should be avoided. Asymptomatic transmission, meaning people who have no symptoms while they are infected but are actively spreading infection, is a major source of transmitting disease. And therefore, you cannot assume that just because you or others say they feel well, that they are not infected or spreading disease. And also that testing is important. And we've invested heavily in Kentucky to support testing and have supported local health departments, hospitals, community-based testing through local health departments and a number of other avenues, including distributing hundreds upon hundreds of thousands now of those Abbott Binax Now cards to a variety of locations across the state. So we have very much strong alignment with the message that Dr. Birx shared today. If you could show me the next slide, please. I think it's Jim today. This is national data. It's similar to what I shared on our purple stair-stepper graph for Kentucky in the past. You see the first escalation in the spring with the gray line. You see the second escalation in the summer, and you see the third one happening now in the winter. You can obviously see that the line is much steeper. I'm going to show this differently in 2 more slides, and I'm going to draw some other conclusions. If we could have the next slide, please, Jim. She made the observation when she spoke today that the first surge was smaller in multiple dimensions. The second surge was bigger. It rose more quickly and lasted longer. And the third surge is escalating much more rapidly than the first 2, lasting a lot longer and resulting in much more harm. And I hope the next slide now, Jim will show this using the same graph. The first surge was relatively small in comparison in total numbers. It hit smaller number of areas, and it lasted more briefly, less than 4 weeks overall before it hit peak and then plateau. The second surge lasted for about 5 weeks nationwide before it reached its peak and started a decline, but it rose again relatively quickly. And if you look to the right, the current surge, the one we're in right now, the one that Kentucky is desperately trying to prevent from becoming an even bigger crisis, has risen much more quickly. is lasting much longer. And now 8 weeks into this surge, it still has not yet reached its national peak, which is alarming because that means it could be far, far worse than it already has been. James, if you could show the next slide. I alternate James and Jim because we've got James and Jim both working on this. I'm sorry. So Jim or James, I think it was James in this case, has made an animation for us out of the 4 other slide progressions that Dr. Burke showed. So this is the number of cases per 100,000 people, and this goes all the way back to March, I believe, and goes forward from there. So if you could please start the animation. So as this goes, it's going to show you how the number of cases has progressed over time, and it actually shows shaded our surrounding states and what their impact was. The federal government has added additional depths of horror by making even darker shades of red. We have spared you that here in Kentucky. The darker reds are serious crisis areas where cases are really off the chart. If we can go to the next slide, please. This is the number of people admitted to the hospital. And I've said this repeatedly, more cases equals more admissions. So if you could start this animation, please. There we go. It doesn't really take much explanation, and you can see the areas hardest hit. Again, adjusted per 100 inpatient beds. So we adjusted all of these by units to kind of adjust for the capacity in the regions. And that shows you where the hardest hit hospitalizations have been so far. If you can do the next slide, James. This is the number of deaths per 100,000. If you could start it playing. And it's not just about cases. It's not just about hospital admissions. All those metrics lead to real people losing their lives. And it leads to other people obviously having other types of impairment and distress because of the dysfunctionality that the pandemic and the disease brings about. And then James, I think, is there one more slide, James? If you move to the next bit, wonderful. And test positivity is a measure of testing adequacy. Are we testing enough people? But when the disease grows much more rapidly than testing can grow, you start to see we fall behind and the number of people testing positive increases. And you can see that that chart has also changed to a much more red shade. Tennessee had a data problem on a recent week or something. She explained that's why it's whited out there. So I'm going to leave a few concluding thoughts on this. The governor has shared over the last few days that we had for a period 9 days sequentially of decreasing test positivity. We have had, I think now, at least some semblance of a plateauing of our cases for new positive cases. We will have to see what happens this week because I think that Thanksgiving is in direct conflict. The behaviors at Thanksgiving are in direct conflict with the measures we took with the executive order to keep ourselves further away from each other. We took those right before Thanksgiving. And notwithstanding that, the fact that we have a decline in cases last week instead of an exponential increase, I don't have any doubt, folks. We have shown in Kentucky 3 times, all 3 of those rises that Dr. Burke showed nationwide, we have interrupted those climbs in Kentucky 3 times. I no longer know what to say to those who will not believe this. There is a direct cause and effect relationship when people get close to each other without a mask on and spread their secretions, and, essentially spray snot and spit at each other, you spread infection. And when we stay away from each other and we cover our faces, we don't do those things, the infection doesn't spread, hospitals don't get overrun, and people don't die. We have one of the worst overall health statuses, unfortunately, in the United States of America. And despite that, we have one of the best performances in the entire country for low numbers of death across the state. At this point, we've shown 3 times that when we intervene, we can have a positive impact, save lives, and minimize disease. And other states who have taken very different paths have shown just how bad it gets when your hospitals are overrun, there's nowhere to go, the doctors, the nurses, the others are exhausted and worn out and can't help all the people who need help. So here's my admonition to the state as we look into the next couple days. It strikes me that this job has been so unrelenting that Christmas is now upon us, and it feels like it's Groundhog Day over and over, and they all blur together. You know what needs to be done. As hard as it is, you need to stay with only your own household all the way into the new year. You need to not have private gatherings and parties. You should support, if you are able, and please support local business, but do it through takeout and carry out. Please support the businesses, but don't support the disease. Don't support the coronavirus by getting together with people outside your household in public spaces in indoor settings where you're going to spread disease. It is not safe, and people will pay a price for that. Some with their lives, others with illness, and others who aren't even infected by COVID because the hospitals will get overrun like they have in other states. Right now, if you have high-risk conditions, if you're over 60 or 65, if you have major medical problems, it is not safe to go into indoor settings with other people not wearing masks. It simply is not safe. And I urge you, we've changed our travel guidance today, and I was late to the press conference due to a prior commitment, but the travel guidance online now says that we discourage leisure travel until further notice. Until we get past the holidays, folks, please, it's time to hunker down. And remember, you can only control your own choices and your own actions. If neighbors and others in the community choose not to adhere to this guidance, and there's plenty of guidance out there. We said this for months before we had to finally get to the additional executive order before Thanksgiving. If people follow the current guidance that we already have in place, and if you adhere to the mask mandate, that's all the weapons you need. That's all the tools you need to keep people healthy, to keep people safe, and to prevent us from having the calamity here in Kentucky that is unfolding in states around the nation. You can do it. I have faith in you. But if others choose not to do it, just steer a wide path from them, stay away, and please don't support and don't participate in those behaviors. Nevermore have your individual actions had a chance to have more impact for more people, both in your immediate circle of friends and family and people you love and care about, but your broader community. And the final message I'm going to leave is about the vaccine. It is wonderful news, absolutely wonderful news this week that we have our first doses of vaccine in the state, that our health systems are beginning to administer it. I have to ask you all, this is a time for us to think about us, not me. This is a time for us to understand that we have a modern medical miracle. We have vaccines 10 months from the time we had our first case in Kentucky. There is nothing like that in immunization history worldwide. That is absolutely astounding. In that context, we now need people to be patient. Please don't ring the hospital phones and the public health department phones off the hook with all sorts of questions immediately and begging to get the vaccine. We are going to roll it out as crisply and cleanly and rapidly as we possibly can in as fair and an equitable manner as possible. I talk to thousands of people every week, literally thousands of people, hospitals, health departments. I join the governor for calls with other leaders across the state. We are trying to message as clearly, as consistently, as rapidly as possible. There is only so fast that information can get out, and there's still much we don't know. But these vaccines are a game changer. The beginning of the end of the epidemic is upon us, but it is going to take us the next 6 or more months to methodically work through this. So I thank you very much for your patience. It's absolutely essential. And I, again, thank the governor for the privilege to serve. This has been a singular honor to have the opportunity to serve in this time. And I'm looking forward to getting past this and finally getting to a vacation next summer when we can hopefully declare mission accomplished and we can help all the Kentuckians who've been hurt by this get back on their feet and get back to the lives that they miss so much. Thank you very much. And Governor, back to you.
Thank you to Dr. Stack. You know, I knew we've been dealing with this for a long time. We got a question several months ago about smoking, and Dr. Stack didn't start the answer with "don't smoke." Well, our new travel advisory is "don't travel." Now, right now, it's dangerous. Don't travel. It can be that simple. The vaccine is out there, and we're going to make it. Appreciate Dr. Stack's effort. He works incredibly long hours and sees or experiences a lot of the frustrations that I and local health departments, hospitals, and others understand. We couldn't do this without him. All right, we will open it up to questions. We will start with Karen Czar from WUKY.
Good afternoon, Governor. Thank you. We've had a lot of questions from private school leaders or school districts where they are not over capacity and we're already able to make adjustments, meaning cut off enrollment so that they could socially distance and follow all those guidelines. With the new guidance that you set yesterday, if they are in a red zone, but they are already at reduced capacity, do they need to make any changes or can they move forward?
What on the red zone, orange zone, yellow zone, those pieces are recommendations as opposed to some other mandates that will be in the executive order that come out. But I think that those schools are already looking at. So if they are already at significant reduced capacity, what I would say is if you're in the red zone, just look at your overall operations. See where there's a little more that you can do to protect students, knowing that there's the community transmission. Just be thoughtful and be extra wary, given that level, the CDC says is dangerous everywhere in a community. And that's one of the reasons that we didn't just change the numbers. If the CDC says this number is dangerous, then we're not going to adjust that, just because so many of our counties are in the red zone. So again, what those recommendations are for the orange and the red zone is asking people to be really thoughtful and to not stop, to say, this is our plan and we've already implemented our plan and we're going to stick with our plan, and not say, okay, where are some other things that we can do a little bit more? Look at even the CDC continues to provide new and additional insights on how to make facilities, including schools, safer. So that's all we'd ask, and we'd ask for leadership in it. And that's going to occur for private schools on the school level, and it's going to occur for public schools on the school and on the district level. Joe Sonka from the Courier-Journal.
Thanks, Governor. Do you plan on providing a public running total of how many people are being vaccinated each day in Kentucky, along with any demographic statistical information about those people?
We're working on it. We were looking at that just yesterday. We don't have it up and running yet. The vaccine got here a little bit faster, and then we'll have to see if we can get that reporting every day. But we're working on it. This goes into a federal database, but it's something that the Department for Public Health was already working to create a dashboard. Certainly, we want to have demographic data if we can by the time that it gets out of the initial populations that we're looking to help. I mean, the demographic data for long-term care, obviously, we would see by age, but we need to be able to test as we go whether or not we're reaching underserved populations. And to do that, we're going to need some of that data, and we're committed to it. So we've got to know of say our educators when we get there, our individuals getting data, even proportionate to the population or portion of the population they may make up. We got to make sure that we message to and are able to allay concerns that may exist in various communities. So we're going to be working really hard on that, and we're going to work to be transparent on it. Again, I saw a draft of a dashboard yesterday, but it's going to be a work in progress. Tom Latek from Kentucky Today.
Good afternoon again, Governor. I know you had said in your earlier briefing after a meeting with Dr. Birx that she was meeting with legislative leaders. Have you gotten any word on what came out of that meeting?
Well, that meeting had a presentation from Dr. Birx with some of the pieces that you saw today. Legislative leaders saw each and every one of those slides, got an opportunity to ask questions as well. I think some of the questions were technical about should someone in this situation or that situation be looking at the vaccine, and they got an answer directly from Dr. Birx. But Dr. Birx had called us in the governor's office coming in and said, we have this amount of time. What would you like for us to do? And so we offered the opportunity to legislative leadership without me in the room to ask any question from one of the two foremost experts in the country that have been dealing with this virus. And if you look at the slide she showed, I think that what that foremost expert told them without me in the room is that the steps we've taken work, and where people are not taking action or don't have authority to take action, you've seen really dire consequences. Joe Ragusa from Spectrum.
Hi, Governor. So I want to ask about contact tracing, and I'm sure you've probably seen the data released by New York a few days ago regarding contact tracing and what it has revealed in terms of where cases are coming from. And a large percentage, almost 3/4 of it, was household and social gatherings. Other places that have been targeted and restrictions in Kentucky and other places were kind of relatively minuscule in terms of their overall data. I wanted to know if you had a reaction to that, if you've seen it, and I know we've talked about this before, but why is Kentucky not able to provide data like this?
Well, we just have our local health departments working in the same database for the first time in our history as of October, and we hope to have more data available. But let me be really clear. Dr. Birx, who lives and breathes this, has every bit of data available to the federal government from every single state. Agreed that we needed to take the steps we took, and even included in-person dining in her slides showing to legislative leaders. Let's get off this fiction that the steps and the places that we had to include in our most recent executive order aren't places where this spreads. We have 3 times had to ask for sacrifices in those areas, and it's worked all 3 times. So if the question is why we chose what we did, it's because it's worked. It worked here, and it continues to save lives. We also addressed the gatherings by limiting gatherings in people's homes to 2 households, 8 people or less. Got sued over it, won thus far. But we took that step as well. But when you are going to take a swing at a virus, you don't say, well, about 40% of it happens here, we'll just do that. We've done, over that 3-week period, as much as we can to impact the virus. It is similar to what we did in July, and we're seeing good results. Shelby Lofton from WKYT.
Thank you, Governor. Of the healthcare workers who were vaccinated yesterday, can you give us an update on their status, if they experienced any side effects or reactions to the vaccine?
To my knowledge, they are all good. I think there's some soreness in the arms, but they understand that. We know of no adverse impacts at all. I think that the only thing other than a sore arm is a full heart and a lot more hope moving forward. It was moving yesterday to first see some of the initial vaccines, but then also the videos, certainly in Lexington, of a doctor who's been on the front lines holding that thank you note. This has got a long way to go, but this appears to be a very safe vaccine that is incredibly effective. So it's really good news. Mike Valenti from WLEX.
Yeah, Governor, thank you. It appears we may be on the precipice of ending a month-long stalemate on COVID relief. Right now, congressional leadership is meeting with Secretary Mnuchin to try to hammer out a deal. But new reporting suggests that state and local aid probably won't be in that comprehensive package. Obviously, we've heard you for months now stress just how crucial that is. Your response to that, and have you had any conversations with Leader McConnell about that?
I haven't talked to Leader McConnell, certainly in the last couple of days. Americans need help. They need relief. Those are on unemployment need an extension. That's got to happen. And that looks like it's going to move forward. But we provided our entire congressional delegation with a breakdown, not of different things we need for our budget, but just what it'll cost us to do the testing and continue to fight this virus for the first 6 months of next year. And it's about $350 million. Right now, what Congress is telling us is you are on your own in battling this virus, except for vaccine distribution, beginning in January. And that is an abdication of responsibility. In the very least, they ought to give us money to do testing. At this point, that's all I'd be seeking, is just give us the basic dollars to cover what it takes to continue to contain this virus as we get the vaccine out. And there's an end in sight. Why would we stop funding the programs that are working to protect people and identify people that need help? Think about this. If we don't have testing to show people are positive, think about all the stories, and we know that people are doing okay who are positive, then they fall off a cliff. Some we lose, some we're able to get to fast enough. Well, if people don't even know they're positive, by the time they get ready to go to the hospital, it is going to be too late. So what they're calling state and local aid may mean a lot of things, but I would hate to think that we are conditioning dollars for testing for a virus on business liability protections. Again, that just puts people in harm's way, and they ought to be able to come to some form of compromise on those two as well. Corinne Boyer from WEKU.
Hello. For people who are uninsured or underinsured or who can't afford the vaccine, will there be state or federal funding that will help pay for it? And if someone can't afford it, will that prevent them from getting?
So vaccine is supposed to be free, but the devil is always in the details, and we will see as it's rolled out. At different times, some have talked about a small administrative fee. We're going to make sure here in Kentucky that we do whatever it takes to make sure those that are uninsured or underinsured, and if there is any charge, can't afford the vaccine, can still get it. No one should have a barrier to getting this vaccine if they want it based on cost. That's my commitment, and we will make it happen. Julia Hunter from the Hoptown Chronicle. Do we have Julia? All right, we'll come back. Melissa Patrick from Kentucky Health News.
Hi, Governor. You said earlier today that Dr. Burke suggested Kentucky needs to increase its testing of those between the ages of 18 and 30. What exactly was her advice on how to increase testing in this targeted group, and were those suggestions that you will consider?
Well, certainly consider the suggestions, and we've got a really good working relationship with Dr. Burks. She believes that tailoring a testing site or sites specifically to that age group and having more of the rapid tests, in some ways trying to create an experience around it could help. And so those are ideas that we're looking at and we need to flesh out and figure out. It's certainly a population that if we could get to do regular testing, we could not only see and prevent asymptomatic spread, but we could also get some behavioral changes because we all want to pass the test. And this is the only test that we ever take where, well, there's several, but we want to be negative as opposed to positive. We want the minus instead of the plus. So we'll absolutely consider that and try to figure out how it works. It does suggest some of the college testing that they have done, was ahead of its time, and that may be a good model. Alex Ebert from Bloomberg.
Good afternoon, Governor. There are many stories, including out of our publication, indicating that President-elect Joe Biden will nominate Pete Buttigieg to be his Department of Transportation secretary. How will that impact Kentucky's ability to get funding for roads, perhaps bridges between your state and Ohio's in the next administration here, compared to your ability to get funding with such a close connection to Elaine Chao? Thank you so much.
I believe that we will be treated fairly. We've had a good relationship with the current administration, even with me being of a different party than the president and most of the cabinet secretaries. We believe we'll have a good relationship moving forward. Pete Buttigieg, I've met a couple of times. I believe I will know a number of people that are likely to work with him in that cabinet. Javier Becerra is a friend of mine who is going to be nominated for HHS, and with Kentucky's challenges that we face and healthcare being so important to us as a commonwealth, I think that's going to be a big advantage. So I believe that we're going to be able to work well with Pete Buttigieg. Now, remember, he's mayor from Indiana, and we got a bridge that we need to build there too. So a number of large projects that I hope this administration gets behind, because we could create a heck of a lot of jobs at a time we need them. Okay, we'll go now to Julia Hunter from the Hoptown Chronicle for our last question. Oh no, Julia, did we lose you?
Okay. You have specifically tailored the vaccine distribution plan to lessen the burden on hospitals and healthcare workers. And I was just wondering if you could talk about how quickly you anticipate seeing those results and the burden on the hospitals start to go down.
So we believe that we will see burden on the hospital as far as members of long-term care needing to go to the hospital within a month. Now, that might not change the numbers hospitalized in a way that reflects how many resources are going to be freed up. For every long-term care patient that we are able to get this vaccine and that is not hospitalized, that frees up significantly more time for the doctors and nurses in that hospital to see a number of other patients, because of oftentimes the condition of someone in long-term care and how hard this virus hits them requires significant, sometimes around-the-clock attention from hospital staff. So I believe within the hospital, in ways that are going to be a little bit harder to measure, but I believe that those professionals working at the hospital will be able to tell you about it. Our capacity after the first, I would say, month of vaccinations in long-term care is going to be better. Now, also the number of healthcare workers getting sick is something that ought to decrease as well. Remember, there are a lot of healthcare workers, so it will take some time to get through them, but that's another place that we ought to see a change in those numbers. Still a couple things we don't know about the vaccine. If you can spread it or not. We do know it keeps you from getting sick. So we're gonna have to be a little patient in seeing the numbers. And like they say nationally, we need to get at least 70% of the population vaccinated to truly make a major, to truly get to the end of this. But I'm seeing that as not only possible, but probable. So a lot of good news today. Still in a tough place, still have far too many cases, still losing way too many Kentuckians. But we are going to win. We're going to defeat this virus. We're going to defeat it in 2021. And we are going to get back some of the old normal things that we like and that we love. And then we're going to have some new things that we've learned along the way that I know we're going to be able to put to good use. Renewed compassion embracing telehealth and everything that it can provide, building new jobs here in Kentucky that can be remote, working for companies all over the world in a way that we've never seen before. So it's another good day. It's the second best I've felt since March the 6th, yesterday being the best. We really look forward to getting this vaccine out to everybody who wants it. Be patient, and that patience is going to be tested, and it's going to be difficult because everybody's going to want it as soon as they can. We're going to make sure that we get it to you. We're going to make sure that we get those who are at highest risk first. But as soon as we can get them into Kentucky, we're going to get them into people's arms, saving relatives and people every day. So now, every day, we don't just save lives by the choices we make. We save lives by those we're able to vaccinate. So we'll be back on Thursday with more updates. Kentucky, keep working hard. We're going to win. Let's make sure we protect each other along the way. Thank you.